I'd like to introduce pharmacist Dr. Mark Mandel, owner of Mark Drugs Compounding Pharmacy in Illinois, United States. Thank you for joining me, Mark.
Oh, you're welcome. Thank you for calling me.
Could you tell us when you first heard about LDN?
I first heard about LDN in the mid-1990s. One of my patients' husband was using LDN for a couple of conditions that he had. At that particular time, he had been diagnosed with cancer and with autoimmune diseases.
Mm-hmm. And how do you compound your LDN?
LDN is an unusual chemical in the sense that simple is better, and the LDN, when compounded alone with lactose sugar, is the most readily absorbed and available source. If you try to play with it and make it into a sustained release product or alter it, it seems to decrease the effectiveness of the product. For those patients who are sensitive to lactose, the only other modification or alteration we would do was we would put it in combination with probiotics. And that seems to have a beneficial effect for many patients as well. However, it's atypical to do it other than with the original lactose sugar.
Mm-hmm. Do you do a liquid or a cream?
I have not had an opportunity or a request for either of those dosage forms, but it's certainly a possibility. As a compounding pharmacy and compounding pharmacist, we have the ability to put chemicals into any dosage form that is effective. To date, I'm not aware of any studies or any utilization in a liquid or in a transdermal cream, but I would certainly be open to that if indeed it was a required or appropriate dosage form.
Mm-hmm. A lot of children with autism use the cream. That was only why I mentioned that.
That's an interesting option. Children using the cream who are autistic. We've used a number of creams and a variety of medications with autistic children, and since we have a wide spectrum of patients there, it certainly does provide an option, and I'm very interested in finding out more about that.
Okay. And do you ship your LDN?
Yes, we do ship it all across the domestic United States, the continental 48. We do not ship anything out of country, and at present I have no patients in Hawaii or Alaska. So we do limit it to the lower 48, if you will.
Okay. And what conditions do your patients take LDN for?
LDN, as I mentioned before, is a remarkable chemical. What it actually does, at least what it does according to the theory and the data, is it in a very, very low dose. When taken at bedtime, it increases the amount of endorphins or internal opiates the body produces by 200 to 300%, so by 2 to 3 times the normal levels. That effect not only helps with longitudinal non-malignant pain, but it also seems to help spur the immune system. So patients with cancer, with multiple sclerosis, with chronic fatigue syndrome, with fibromyalgia, rheumatoid arthritis. We've seen LDN used, low dose naltrexone used with all these patients with success. Now, as far as dosing on the low dose naltrexone, that can vary anywhere from a minimum of 1.5 milligrams at bedtime to the maximum effective dose of approximately 4.5 milligrams at bedtime. And that is actually the 4.5 milligram dose is typically the most common dose. The reason there is a variety of doses is that different patients have different response rates. And depending on the condition that's being treated or being modified, the different concentrations or different dosages may be appropriate for different patients.
Mm-hmm. Do you have many doctors locally to you prescribing LDN?
We probably have about 24 physicians who are ordering LDN, although there's only about 4 or 5 that find it as a significant portion of their practices. The others are mostly responding to the demands and needs of their patients. Mm-hmm. So if we have a patient who is older and, say, on Medicare and seeing a conventional physician rather, that the patient will ask us to forward information to the physician, educate the physician so that that doctor can order the LDN on the patient's behalf. However, physicians that work in an alternative area who are more open to alternative approaches to these conditions, those are fewer in number, and those make up the bulk of the physicians who are ordering the low-dose naltrexone for us for their patients.
Mm-hmm. So if there are any people in the Illinois area looking for a prescribing doctor, you'd be able to help them?
Undoubtedly. We have physicians in the Chicagoland area, in central Illinois, and in northwestern Illinois. We also work with physicians in Wisconsin and Indiana, which are these states surrounding Illinois and surrounding the Chicago area.
Mm-hmm.
So, physicians, we're very fortunate, we're very blessed in that physicians reach out to us in many cases because we are a very well-known compounding pharmacy.
Oh,
and then we're able to refer patients directly to them.
Mm-hmm. Well, that's very good. Have any of your patients reported any unusual side effects to you?
Unusual side effects. The majority of patients that report any type of side effect would be the very vivid dreams.
Mm-hmm.
The vivid dreams are typically not disturbing. However, some of them can be quite. Some of them can be disturbing. Some can be very, can cause some anxiety. If the patient knows in advance that their dream cycle may be affected, then they're certainly not disturbed by those dreams. But that's probably the most typical thing is that the very vivid dreams. Otherwise, we've had no significant adverse effects or no significant side effects from the low-dose naltrexone treatments.
Mm-hmm. We found from a survey that we carried out that only about 5% of people experience side effects at all anyway.
Right. It's amazing when you consider that the appropriate or normal dose of naltrexone for the treatment of alcoholism or drug abuse is approximately 50 milligrams, mm-hmm. and that you don't even get into any toxicities until you're at 8 times that level at 400 milligrams. The 1.5 to 4.5 milligrams that are used at bedtime for the treatment of these autoimmune conditions and cancer, etc., is a very, very tame, very mild dose. So we would not expect any dose-related side effects. The majority of adverse effects, if you wish to call them that, such as the vivid dreams, are because the patient is experiencing a deeper sleep than they have been. And as a result, they're entering into that REM sleep pattern, and and dreaming is a way of our bodies to psychologically eliminate stress and to deal with issues that we may have during our waking hours that we're maybe perhaps not comfortable with or that are unresolved in some other way. So those dreams, although they may be different than what the patient is accustomed to, and vivid, which is what they are also not accustomed to because they're frequently not reaching that deep REM sleep, that explains, quite often why they are so vivid. But they're typically not as disturbing, once again, if the patient is aware that they may occur. Mm-hmm. And it is certainly a way to lower overall blood pressure. It's a way to decrease other overall anxiety because this is a natural and appropriate way that the body treats stressors or treats unresolved issues is through dreaming.
Mm-hmm. And do many of your patients stop taking LDN for any reason?
Our patients tend to continue using LDN for anywhere from 1 to 3 years, or longer. I really have not tracked it beyond that. Mm-hmm. Because we find that we're able to give the patients a lower price with a larger quantity of low-dose naltrexone, they tend to get 3 to 6 months supply at a time. As you get to a 3-month or greater supply, the price of the LDN drops to less than $20 a month.
Right.
So and $20 a month is what, about 14 pounds, 13, 14 pounds a month. So it makes it quite economically reasonable, especially when you compare the benefits and compare the pricing of some of the other medications that are available to treat these autoimmune conditions. Not to mention the low-dose naltrexone has a very mild, virtually non-existent adverse reaction profile compared to the other conventional medications that are available for autoimmune conditions.
Mm. And without the awful toxicity as well.
Well, again, those toxicities I would relate to the adverse drug reactions, the ADRs. And, those adverse reactions can be anything from simple nausea to complete fatigue, which are some of the things that you're trying to combat with conditions such as multiple sclerosis, rheumatoid arthritis. Some of the adverse reactions can be blood dyscrasias, severe impairment of the liver or the kidneys. Any of these what's called monoclonal antibodies, or MABs, this entire class of drug, which are used for autoimmune conditions, which can be very dramatically positive for some patients, can also have a very wide range of negative impacts. I mean, many of them increase the risk of cancers. Many of them increase, a number of other longitudinal diseases when using them. Low-dose naltrexone has none of these side effects, none of these adverse drug reactions. And again, it's a fraction of the price of these other medications.
Mm-hmm. Is there anything else you would like to add?
Just that I've been amazed since I first learned about low-dose naltrexone, which was quite some time ago, at the positive results and the positive benefits that our patients have seen. I've had patients who have been diagnosed with breast cancer who decided to use low-dose naltrexone in conjunction with other treatments, who've seen a reversal of the breast cancer. The same thing with colon cancer and prostate cancer. And the unique thing about these is that breast cancer and colon cancer tends to be rather aggressive, and prostate cancer tends to be a very slow-acting disease. Our patients with multiple sclerosis see the reduction of fatigue anywhere from 20 to 75%. Their ability to walk distances is increased by, again, 25 to 75%. Some patients have seen a 15 times increase in the number of steps they're able to take during a 24-hour period. And that's just dramatic. A 1,500% increase in your ability to be mobile is phenomenal. Again, this is all done very economically and virtually side effect free. So I'm extremely impressed with the low-dose naltrexone. I'm extremely impressed with the physicians who have opened their eyes and opened their minds to the utilization of this alternative approach, which is something they were not taught in medical school, but something they were open enough to be proactive on their patients' behalf. And, I encourage patients to contact me if they have questions. I can be reached through our website at markdrugs, markdrugs.com, or you can email us through our website at info@markdrugs.com.
Well, thank you very much for sharing your experience with us.
You're welcome. Thank you so much for calling.